hasn't started yet for me either.
Hello, everyone. Welcome to Pre-Dental Universe. We're having today Dr. Jackson as a prosthodontist. She'll be sharing her journey with us. We're most likely going to be focused on what the specialty is, and the doctor will be happy to answer all of our questions at the end. And then hopefully we will have a later session where it'll be just case focused. And let's get started.
Thank you. First, I want to just say thank you for everyone who's joining. I know you can be spending your Thursday evening doing something else, so thanks for sharing it with us. My name is Gabrielle Jackson, and I am originally from Chicago, born and raised. I'm going to tell you a little bit about my journey to dentistry and also into prosthodontics, but also give you a thorough background on what the specialty of prosthodontics is within the field of dentistry. This is going to be really relaxed, and I'm open to answering any questions throughout, so you can stop me at any time if you'd like to answer a question, ask a question. I'd be happy to stop as we go along. Okay. There we go. Okay, so just starting out with the specialty, maybe before that. No. I'll tell you a little bit more about me later on. How about that? Okay, so the specialty of prosthodontics. If you break down the root words, you have prosthetic or pros, which is derived from prosthetic, meaning relating to a prosthesis or a prosthetic, meaning something that's fabricated, right? And then odontics, meaning odontia, which pertains to the bone, connecting tissue, and the gum surrounding a tooth. So basically, prosthodontics is the specialty of replacing missing parts of the teeth and mouth. Specifically teeth, oral structures, but also other structures within the head and neck region. This specialty became a specialty back in 1947. And when we talk about teeth, oral structures, and other structures in the head and neck, that means prosthodontists can create ears or fabricate removable or replacement noses or eyes, actually, especially if they oftentimes coincide with missing teeth and all those structures were lost in the same way. The prosthodontist will fabricate a prosthetic to replace everything. All right. Now, I think there's one thing though. My view shows the people in the team. How do I change that? Like it's on the screen in front of my slides? That's something I change on my end?
Yeah, you can click on the top right corner. You should see just one screen that you can click
You're
on.
muted, share.
Sorry, guys. Well, it's okay. It's fine. Okay. So what type of patients do prosthodontists treat? Well, most of the patients have complex needs, meaning that, hold on. Can you guys see this? Can you see what I'm doing?
No? Yes, we see the patients we treat have a history slide.
Oh, okay. Never mind. The patients we treat have a history of dental neglect. That's probably the biggest one we see. So basically patients who just haven't been able to have treatment or have decided otherwise or have experienced a lot of dental trauma in the past that has prevented them from seeing a dentist for a very long time. As you can imagine, when you have a small problem or one problem and you have a lot of time passed, that accumulates. And so, these patients often have significant problems when their dental health has been neglected for a very long time. We also see a lot of patients with congenital disorders. So meaning patients who maybe were not born with teeth. We see a lot of patients like that. And so prosthetic rehabilitation of their smile is needed just because of a disorder in their genes, maybe carried through their family. We treat a lot of patients like that. Drug abuse, that's another big one. Oftentimes when patients or just people in life go through dark times, oral health is not something that's on the forefront of most of those patients' minds, even self-care. So a lot of times oral health goes down and goes down pretty fast. And so rehabilitating those patients, especially once they're sober, is a big part of the treatment we provide regularly. Then also we have trauma. So a lot of patients either have trauma from an accident. It could be trauma from other things as well, which is the next one I'll show you. I believe it says cancer. Is that what it says?
Yes.
The next one, maybe? No?
Yes, sir.
Yeah.
Oh, it did? Okay. I'm sorry. This whole panel I can't see. But even trauma, if you will, from cancer, meaning that if a patient has cancer in the head and neck region, they get that area basically surgically removed. It's essentially a trauma, and we have to make replacement teeth prostheses for those patients too. So those are the general types of patients that we treat. Of course, there's a lot of different people in between. People like you and me, if you had a single tooth that was missing, you could see a prosthodontist to have that replaced too. Okay, so how do we replace these missing structures? So there's different types of ways. Basically, if we break it up into two components, we have surgical phase and then we have the restorative phase. Oftentimes when patients are missing parts of their body, you have to have a surgical component, which oftentimes anchors whatever the prosthetic is that you're going to fabricate. So that surgical phase oftentimes happens first. There may be multiple surgical phases, maybe one round where there's bone grafting done. You have to have some healing time for that. And then you come back and place the implants, healing time for that. And then finally you can put some teeth on there or whatever type of prosthetic you're fabricating. So that's the typical way things go in prosthodontics. And so surgical, like I mentioned, we do bone grafts, we do soft tissue or gum grafts. We also, for the hard tissue, we contour the bone. That's what alveoplasty means. We sometimes have to shave down bone, add bone, and then we're basically preparing the site for implant placement. That's the number one surgical procedure that's often done in preparation for implants and teeth, is the placement of the dental implant in the bone. A couple cases there. Okay, and then after that, after all the surgical part is done, we have the restorative phase. So that's basically broken down into really two main categories. You have something that's removable that you take in and out, that you wear, during the daytime, you take it out at nighttime, kind of like you got to take your shoes off at night to rest. You got to take the prosthetic out. And then we have fixed in place. Fixed in place is often, it's the best treatment you can have, because just like the natural teeth, we're born with, they're fixed in place until you lose them. And so when we can get something that's fixed in place with an implant, that's going to provide patients with the best long-term outcome, and also just an improved quality of life in general. Maxillofacial, that's a separate category, which I'll talk more about. But that's dealing mostly with patients who have had a history of cancer or some sort of lesion that required a removal of that tissue or area, and also they need a replacement for that. So your journey to prosthodontics. Well, oftentimes you have to get a bachelor's. There are some programs where you don't actually need a bachelor's degree. You can just fulfill the requirements needed to apply, and you can apply as soon as maybe your third year actually of undergrad. UNC is one of those schools, UNC Chapel Hill. One of my dental classmates hadn't yet got her degree, but she did do 3 years of undergrad and fulfilled the requirements to go on to dental school. Dental school is 4 years long. There is a 3-year program. But most schools are 4 years, and they will confer a DDS or DMD degree. They're both equivalent. After that, you would do a residency of 3 years. There are some programs that have shorter lengths, maybe 2 years, but most of them all are 3 years. And many of them have the option of obtaining either a master's degree with that specialty, or you can get a certificate. in the specialty of prosthodontics. So it just depends. After that, you can go into the subspecialty, maxillofacial prosthodontics, through a 1-year fellowship. And it's offered, it's an even smaller specialty within an already small, or subspecialty within an already small specialty. So just further and further specialized, depending on the patients you like to treat. Following a prosthodontics residency completion, and whether you get your master's or not, there's different options to practice as a prosthodontist. You can go into private practice. You can go into practice with a corporation, a larger corporation, or you can go into practice with an institution, such as a dental school, or you can work at a hospital. So there's a lot of different pathways you can take within the field, and so you can really customize it based on the things you like. Any questions so far?
We're going to take all the questions at the end of the session.
Oh, okay. Yes, ma'am. All right. And here I just have a slide of some of the patients I've treated to give you a kind of a range of the treatments that we provide. In the top left, we have a patient who was in a major car accident, lost half of his upper jaw and lower jaw. And we're in the process of rebuilding his smile. He survived the traumatic accident, and now he wants to be able to smile and chew again. To the right of him, we have a patient who had nasal cancer. And this was fortunately caught pretty early, but surgery is required. What's really nice is when we can catch cancer early, and we can plan before the surgery happens. So this is where we take an impression of his nose. If you notice, the right side of the nose is the normal size. So we can actually try to recreate his nose in the appropriate shape and size, and have that ready for after he has the surgery and has part of his nose removed. So we kind of get to preoperatively design that, which is really neat, and we can even do that digitally. I've also seen patients that have had severe mental deficits, such as patients that suffer from stroke, very difficult to treat patients. I also treat patients that are young and maybe were doing taekwondo and got a tooth kicked out in the front. So simple stuff like that, but very, very highly technical, and you want to be skilled in order to make things look natural. I have a young lady here at the bottom. She's pretty young. She's the third on the right at the bottom, and she has one of those congenital disorders, ectodermal dysplasia, and that's where we see patients who just have certain teeth that never grow in. Even her small baby teeth on the bottom. So usually when they're about 18 to 21, after the growth is finished, we can talk about and start planning for implants to replace those teeth. We have patients to the left that have experienced a history of drug abuse and who want to restore their smile. So the treatment that prosthodontists provide is truly life-altering and really impactful. And it can be as simple as a couple teeth here and there. Either way, your smile is the first thing that many people see, and to be able to help people is just really, really nice. It's the biggest part I enjoy every day in my job. And so I do want to provide you a little more background on my journey specifically. So I went to undergrad. I went to Bradley University, and after graduating, I was trying to find my pathway to dentistry, and I enrolled actually in a post-bac program. Did the post-bac program. I got into this summer program at Michigan, where actually I met a lot of other pre-dental students, and that's where I was able to get support in preparing for the DAT, the entrance exam. Took that exam, applied, and I was kind of torn between schools, but I ended up selecting UNC Chapel Hill. And that's where I stayed for 7 years. I did my DDS degree there, and then right after that, I did 3 years of prosthodontics residency. I finished that residency a year and a half ago now, and now I'm currently in Dallas practicing at an implant specialty practice. And so I wanted to talk more about what a day for me looks like. So in this practice, essentially, we're only, for the most part, doing implant restorations. So patients who are missing at least one tooth, but oftentimes a lot of teeth, and oftentimes patients who need the remainder of their teeth extracted. And so what's really neat about the practice that I'm at is that we do same day treatment, essentially. And so where we have a patient comes in, we've already kind of worked them up and got a plan in place for them. They're coming in for the surgery day, and we work with oral surgeons. They go ahead and remove all of the patient's teeth or whatever the plan is that day, and place implants. Then, I come in and I get the teeth attached to the implants, and the same day the patient leaves with a brand new smile. So it's really, really, really life-changing, and a lot of emotions. And so the beginning of the day, the patient comes in for the surgery. They're here all day until the big reveal at the end of the day, which is usually right around 5 o'clock. Throughout the rest of that day and that time, I'm also seeing other patients. So I'm seeing new patients for consultations who come in and they're describing their story. They're often very emotional, and they're very open with how their smile has really impacted their life. And many people, how they've been holding back professionally, socially, and they finally have the opportunity to do something for themselves. So a lot of emotion and passion behind patient stories, and even my motivation of what I do every day. Between those consultations, I'm also seeing patients that are already in treatment. So they're here for a follow-up, maybe for their post-op after they've had surgery 10 days ago. Seeing some patients who are at the point where their implants have healed, and we have an opportunity to now rebuild their smile or make any changes to even perfect their smile for the final restorations. And so I'm kind of playing 3 different roles, 3 different hats, all moving around, super busy every day. And it's definitely really rewarding, just being able to really have an impact, and know that, my work and my training and all that I've done is really helping, and that's really appreciated. So that's just a little bit about me and what I do now currently. So I was trained to do all of what you see here, but right now I'm focused on implants in this practice. So I think it might be a good time to take questions.
Yeah, thank you so much for that informative presentation, Dr. Jackson. I'm sure that everybody learned a lot and benefited from it. So now we're going to ask some questions from the live chat, if that's okay?
Mm-hmm.
Okay, so the first question is, on average, how long does the surgical procedure take for one tooth implant?
Okay, so one tooth implant, so believe it or not, implant placement is actually less traumatic than having the tooth removed. And so I think a lot of patients think it's the other way around. Because, if you think about a tooth, it has oftentimes multiple roots. They can go like this way, that way. And the roots can break off, and, they can be difficult extractions. But implant placement is essentially like drilling. I don't want to make it seem that simple, but just for, visualization, it's like just prepping a hole in the wall. Drilling a hole. It's like, it's pretty simple. So with that, it doesn't take very long. So a single tooth implant can literally take as long as 15 to 20 minutes. And we often place those, especially if they're single units here and there, under local anesthesia. For the patients who are having full mouth treatment, we do light sedation for them. We do IV sedation. And even for since that question was asked, for the full mouth cases, for the patient who gets full mouth implants in a day, the surgical portion really only takes probably on average 2 hours. The rest of the time is the lab working on finishing up the prosthetic.
Hi, Dr. Jackson. Thank you again for your presentation. Let's see, another question is, what extracurriculars do you recommend for undergrads?
Good question. So I recommend you get as much experience outside of science as you like. And so even if you want to study something outside of science, actually is really good because it allows you just to be more well-rounded as an individual. That will really help you professionally in any career, I think. So I would explore everything you can outside of science. Prosthodontics is definitely leaning more towards people who like the arts. So, which is definitely me. I've always loved art, and that's how I initially got into dentistry, is the way to put my passion for art and science together. But I say definitely take advantage of things outside of science. Whatever interests you is definitely a, a good look in terms of you as an applicant to dental school. Because, everyone can study and get good grades, but we want people who have more experiences, just have more well-rounded experiences, because it's going to allow you to connect with people and with many more people than maybe just whatever the group that you represent.
أنا عندي session بطلوا كلام.
Anything else? I know this is a hard time for you guys since, the shadowing thing. I mean, offices are open. I think I would recommend that you still reach out if you can to a doc locally. Because even though COVID's happening, dentistry is still happening and the world is still going on. So it doesn't hurt to reach out. You may have an opportunity. You may have to, ask a few docs, but I would still try to get that experience because it's, life is going on and businesses are still open. So there's nothing like real experience, like of actually, being there in the office and seeing the day-to-day action that really gives you the view of what it's going to be like.
Hi, Dr. Jackson. So another question that we have of viewer asked is, do you have to pay for residency?
That's a great question. So for prosthodontics residency, in general, dental residencies, it varies. Most you don't have to pay for, but within the specialty of prosthodontics, I would say most you do pay for. It just really depends. It depends on the institution. So you can work, do a residency at a VA, and they'll pay you. But your training will be very different than that if you went to a dental school and got a training at a educational facility. So it just depends on the experience you're looking for. Oftentimes, though, if you do have to pay for tuition, they do provide a stipend, a minimal stipend. And so you get some support, and just depends on the program. Some offer more support than others. My program, I had to pay tuition, and I have zero regrets about it. Going into the specialty or even, the value of my program based on the tuition that I had to spend, because oftentimes you don't go into this stuff for the money. And when you're doing things that you're passionate about, you don't worry about the money because it'll come. Just keep doing right.
Thank you. That's great advice. So, I had a question about COVID. So how has COVID affected your day-to-day job now?
Yeah. So, a lot has changed even within the day-to-day job over these last several months. I think in the beginning, after the shutdown and things were being reopened, there was definitely a lot of precautions, and a lot of that is still happening. I think some of the anxiety and fear associated with it, especially within the dental offices, has subsided, especially based on the research that shows that basically dental offices don't serve as basically COVID is not being contracted at any rate, really. Less than 1% is what they say within dental offices. So there was a big fear about that in the very beginning. A lot of offices, and including ours, we're still abiding by the 6 feet, the social distancing. We're still checking temperatures every day. And the PPE that we use, we're still, using certain requirements as far as the mask, the N95 masks and such. But outside of that, honestly, I think many people don't think about it, but we're using the same universal precautions as we did before, honestly. With the only real change has been in the masks, because we treat patients with diseases every day, HIV every day, all of this before a pandemic. All the precautions are essentially the same, with the exception of the masks. So everyone's staying safe.
All right, let's see here. What drew you into dentistry in general, and then what drew you into prosthodontics?
Yes. So dentistry. So how I learned about it, well, it's kind of complex, but I'll say I made my mind up to become a dentist in high school. It was my first job in high school. I learned in my computer class, they were telling us about this internship at a dental office. And, and they say internship, and I was like, okay, I need some money, And so this office wasn't too far from where I lived, so I could walk there. And I was the last person to interview, and I got the job. And it was actually the dentist who told me, when I got there, he said, instead of saying like, what do you want to be when you grow up? He was like, what classes do you like most, in school? I said, art and science. And he was like, well, dentistry is perfect for you. He said it's a perfect field for women, especially women who maybe want to have a family and have a good life balance. And so ever since then, I was sold. It was the best way I can put my passion for both of those together and have an impact while doing it and have fun, every day. And I'm sorry, they took the lights off in here. Okay. And so that's where it all started. And from there, I went to a pretty small undergrad. And so I later learned that a lot of larger universities have pre-dental clubs and programs, and I didn't have any of that. So I literally had to figure it out all by myself. So if you're definitely in a larger school and you have a pre-dental program or extracurricular club, I would get affiliated, because there are just so many opportunities that you guys provide to students with that interest, which is really awesome. So in figuring it out on my own is why I did the post-bac, so I could, figure out the steps. And from there, I applied and took the DAT, and everything just kind of kept going for me. I've had no regrets. I think my biggest advice is to really take your time to get to know the field of dentistry. I think sometimes people get into it and they don't know enough. And I think the more you know, the more you can be satisfied and fulfilled with your decision once you get there. And so as I got into dentistry in general, but then prosthodontics. So actually, before I started dental school in Chicago, I was shadowing a prosthodontist. I shadowed him for about 6 months. And what was so cool was his practice was super busy, very successful. He's originally from Syria, and he actually only had 3 fingers on one hand. And he placed a ton of implants per year. And I was like, how can this dude do all this stuff with 3 fingers on one hand? I was amazed. And from there, I knew about the specialty, and I already had an interest before going into dental school. Got into dental school, and my passion for it just grew, knowing that essentially prosthodontics, we treat patients who are hard to treat. And so oftentimes we're like the end of the road for these patients. So they're very appreciative for anything we can do. And that part is really nice. The really also other cool part about prosthodontics is that we get to work with other specialists. So they tend to call the prosthodontist the quarterback of dentistry because we do the planning. We'll work with the surgeon. We'll tell them our proposed plan. We might send the patient to go get braces before they have their surgery done, or maybe before we do the restorations. And so we just connect and work with different teams essentially within the dental field, which is really fun and cool and keeps it interesting. So definitely the collaborative part I love, and I think the very most thing I love about prosthodontics is the ability to be creative. And so you literally can get to the same place with different routes. And so, like, do I want to do this or that, or do I want to make something up? It's very hands-on, and there's a lot more that's involved in behind the scenes that the prosthodontist can do hands-on that most people don't even know about. So yeah, I'd be happy to share more about that with you guys at another time. But the fabrication part is huge within the field. So that's another reason why I just fell in love with it.
Thank you, Dr. Jackson. So one more question that I have for you is, could you explain the difference between veneers and implants for us?
Yes. Okay. So veneers. So when we talk about, we have veneers, we have crowns. I know this has been big, especially in social media and dental tourism. That's a whole nother topic, but people going to get their teeth done, even, Costa Rica, other places. Veneers are, you can think of them like as a press-on nail. They only are restorations for the very front of the tooth. And that's versus a crown. A crown is where the preparation or the restorative part goes around the entire tooth, okay, where the entire tooth is shaved down. So the veneers are more, they're less invasive. And they basically preserve more of your own natural tooth underneath the restoration than a crown does. And everyone can't get veneers. So if you have large cavities or fillings in teeth, then you more than likely, if you want to get some enhancement to your smile, you have to get crowns, full preparations for those. Implants are replacements. When you hear the word implant, you want to think immediately that that person doesn't have teeth. That's the true definition of an implant, because the implant part serves as a replacement of the actual tooth root that was in the bone. So think of just a little nail in the bone. That's and it's a replacement for that tooth root. And the implant, once that's placed, that's separate from the actual crown that goes on top. Those are two different pieces. Those two pieces actually are connected by this middle part called an abutment. So veneers are for people who still have their natural teeth. Implants are for missing teeth. Hopefully that's good.
Okay, thank you.
Yeah.
So you were saying that in prosthodontics, you could see people replacing parts of ears or maybe parts of their noses. So someone was asking, is there a certain case that you've seen that has made a significant impact on you or that sticks with you?
Yes, that's a great question. So in residency, I saw a lot of cases like this. And oftentimes, I think the most common one we see is where the part of the palate is gone from cancer in the throat. There was this one particular case, or actually a couple, but the first one that I saw, the patient came in, she was older, maybe in her 40s. And if you can imagine, the palate of the roof of the mouth, there was a big hole. And right underneath the palate, if you think straight up, is the nose. So you can literally, she would open and you can see right into her nose. And she told me that for years, at least probably 10 years, she stuffed the hole with bread, because if there was nothing closing that space, you couldn't understand her speech. It was inaudible. It was kind of like, it was very, very muffled. You couldn't understand anything she said. But if she kept the bread there, her speech, you would never know that there was a hole in her mouth. And so she went on to share her story and what caused that hole. And do we have any guesses? Just wondering what the audience might think. Come on, somebody's brave.
Drugs?
Was that you, Sharita?
Yes.
Bingo. What kind of drugs? Okay, I'll tell you. So this patient had a chronic cocaine addiction. And that's when I first learned that cocaine can cause that type of lesion. So imagine someone who's chronically, and I don't mean to get dark, but I'm just telling you how impactful this story was to me, but because it was really enlightening to me as well. But chronic cocaine snorting causes basically death of the tissue in the nose, which caused the hole in the floor of the mouth, and it eventually got really big. And I mean, it was like this big. But that's where it started. And so she was the sweetest person I ever met. You would never know she had that type of history. And that was just really impactful for me. So then the next time I saw a patient, a young 18-year-old with a small hole in her palate, who showed up with her mom. You know, her mom just said it was there. And then the girl confessed that it was because of cocaine. So that's something that can happen. I don't know that most people know that. Maybe this is your first time hearing it, but now you know. It's definitely something that we've seen outside of cancer cause these type of lesions.
Dr. Jackson, did you practice as a general dentist before going right into your specialty or your residency?
I did as a dental student. So no. All the general dentistry I did was as a dental student. And so my original plan was to go and do some general dentistry because I never wanted to say I didn't give it a try. But then I said, who am I kidding? I know I like this prosthodontic stuff. Let's just get it over with and go into it because I'm excited about it. And so that's how it happened.
Okay, thank you.
Yeah.
So, what are the requirements for your postpartum post program, and what location was your program in?
Okay, for the specialty, yeah. The requirements, there aren't any real a DDS degree, so you got to graduate dental school. Outside of that, you just have to be an awesome candidate, which means that you've done some things other than just go to dental school. You know, more than anything, I think programs are looking for people who are able to connect and work well with others because these programs tend to be small. So my program, they accept 3 per year, and we only have 3 years, so that's 9 people. And it rotates. It's either 3 to 4. It's no more than 10 people in the program at all times. So I think they select 3, and then 4, and they do in that rotation. But because these programs are so small, you want to select people who just, who you want to work with and who keep you motivated and who are helpful. And so definitely showing all of that and your ability to adapt and want to grow is helpful. Of course, you don't want to have a really, have done 4 in dental school, but it's not all about that. And so that's why I say, if you have research, background or experience from dental school or even undergrad, that's always helpful, especially if that's the route you want to take. But yeah, I think you just have to really show the interest. And with that, in terms of, there are 9 different specialties within dentistry. And the best way to know, what you might like is to go and experience it. And my approach was that I went into dental school already knowing that I had an interest in prosthodontics, not knowing for sure that that's what I wanted to do in the very end. But, going to the approach of learning as much as you can about each specialty, which means spending some time in those areas, especially if your dental school has those different programs. And then from there, just crossing out what you don't like and then see what you got left. And, we need a lot of general dentists too. So we really, they're the basis for a lot of what specialists do. We need that regular care. So that's the approach I took that was helpful for me.
Great.
Thank you. So another question was, what things that did you do that helped you stand out to dental school admissions and helped you when it came to interview?
Yeah, dental school. Let me see. So, well, I had a lot of jobs. I had a lot of jobs in undergrad, and I even worked in dental school. I was just telling someone the other day I drove Uber. So I think just to show that you're a little bit of human and you're not just an educational robot. Do some fun stuff. Or something interesting, and I have some hobbies. And really, that's all it's about. Of course, like I said, if you do research, that's fantastic. Or it's either, have good grades, do some research, but also like show some colorful side of yourself. Because really, that's what it's about is just most places, especially these days, want to incorporate some type of diversity because, there's all different types of people who need care. So the more, I think, experience you can get with different communities, the better. And I think I said this, shadowing and getting experience, like hands-on experience, is the best because it's going to give you the most information to make decisions about your own life professionally, but also just exposes you to different things that are even helpful topics to even talk about in your interview. So in terms of interview preparation, actually prepare and have someone do a mock interview for you. Find maybe a current doctor or someone at the school that might be willing to do a mock interview for you. And I would be happy to do that for anybody. I think that's where there are a lot of missed opportunities, actually, when it comes to getting into dental school or any program. Oftentimes, the first important thing is how you present yourself on paper. So you have to know the best way to present yourself to others, and that means you need another set of eyes looking at your CV or your resume. That's really huge. Once you get past that step, it's preparing for the interview. Because if you think about it, you look good on paper. Okay, I want to interview this person. The missed opportunity is when you don't show up for the interview as who you really are. And what I mean is that basically anyone who gets an interview, you have a chance at a seat. And what you want the interviewers to feel and to really see and feel is that you don't want them to say, oh, she was good, she was okay. You want them to say, I like that person. And so I actually have a lot of advice about interviewing specifically because it is very important in getting in. You could be an awesome person and applicant, even on paper, but you can just not nail an interview and then lose out on the opportunity, especially for that cycle, if it's a top program you're trying to go to. So I don't want to spend too much of your time, but it's super important, and I would love to do that for anybody interested.
Thank you. Do you think being artistically inclined gave you an advantage when completing labs during dental school?
Yes, I think, and it's related to in dental school where we take the DAT and the perceptual ability test. I use those skills every day in terms of being able to see things and view things in 3D. And it's 100% related to my longtime passion for the arts. But it doesn't mean that it can't be learned, no. But I do think that it's just easier to see patterns and details that some others without that background just maybe take a little bit longer. It's just learning curve difference, but it's not impossible.
Thank you for that. So going back to the case where the patient was using cocaine. So how would you go about asking if the patient is using drugs in a respectful manner?
That is a fantastic question. And what I'll tell you is that when the second patient that came in with the 18-year-old that came in with her mom, my co-resident was trying to do just that, ask in a respectful manner, trying to figure this out. And one of the older faculty, the senior faculty, came in there, and she said straight up, she said, "You were using cocaine, right?" And then the little girl said, "A little bit," at the same time that the mom said no. Okay. And so sometimes you got to be direct. So I learned two things. It's like, of course you want to be respectful, but sometimes you got to cut to the chase. It was a very interesting observation. I was there just, observing. You just have to really, I don't know, you just have to really think about the type of person you're dealing with, and use your word choice very carefully. But at the same time, something like that, you kind of have to be direct in a way. So I don't know that helps, but
yes, it did.
I just shared that.
Thank you.
Mm-hmm.
Thank you for that. So a more personal question. What is your work-life balance like, and how many hours do you work a week, and what do you do outside of your job to relax?
Yes. So right now, my balance is not ideal, but it's going to get there. The practice that I'm at, we are open 4 days a week. And so the nice thing is that I have mostly all Fridays off, so Friday, Saturday, Sunday. But that means the regular work week is longer. So we get here, I get here probably 6:45 every morning. We start our huddle at 7 a.m. And our huddle is where the whole team gets together. We talk about all the patients of the day. We game plan. Okay, our appointments might be tight here. Maybe you can help out Sarah so we can get this patient out on time to see this patient. And everything is like super fast paced. So, we're here at 7, technically starting at 7, and some days we don't finish up until 6:37. And so if you add up the numbers, it's supposed to be 40 hours. It's probably more like 46, maybe. Something like that a week, which is a lot crammed into 4 days. It is. And so trying to balance is tough, but it's not impossible. I'm working at doing better at trying to get up super early for a workout, maybe twice a week, and trying to meal prep in the beginning of the week. And I think for right now, I'm learning and growing so much that it's worth the time. It's definitely something that you can't do for 20 years, it's a lot on your body. You definitely have to be able to take care of yourself. So the balance is definitely an available option within the field of dentistry in general. It just depends on the person and how passionate you are, and how much I don't know, you just love what you do. I think really it's about the team that you have, and the team that I work with is so amazing. I've said this a lot of times, like I could be working with these people at McDonald's, and I would love going to work every day. Like, and no shade to McDonald's, but I'm just saying, like, we could be working anywhere, and it would just be fun. And so the culture of the team is more important than anything. That's what's going to get you through the long and the hard days, and also like make you want to come back tomorrow. So yeah, that part is still work in progress. Outside of that, though, I like the arts. I think I told you guys that I love anything with the arts. So I spend a lot of time painting and like creating different types of things. I like to eat, so I cook. I like to do a lot of stuff before the pandemic, but in general, I'm definitely more towards the arts in terms of my hobbies and things I like to do. I just got into sewing. Let's see. I like writing too. And of course, a good movie, I just I like new experiences. I like having fun. But it's all different now. I believe in balance. Yeah, for sure though.
What are your long-term goals in the field of prosthodontics? Are you interested in private practice or anything like that?
Yes. So I think one thing I learned with COVID is just in general, no matter what field you're in life, in general, like there's nothing like having your own. And so that's definitely my goal is to own my own practice. And so that's something. It's a goal that takes a lot of planning, a lot of careful planning, and so I'm in the process of working on that while still being present and enjoying the time that I'm having here at this office. So that's definitely the next step.
Thank you. Do you use any technology in your office as part of being a prosthodontist?
Yes, I love technology. So this office, we use digital technology with our scaling protocols. So basically, a lot of our patients, when we're moving into their final restoration, those are designed on the computer. And so we take their models, we scan them, it goes into computer software, then goes to the digital team, which is across the country. They design the case, they send those designs back to the docs for approval, and it just streamlines everything. Patients love it. They faster turnaround times. It's probably the thing that excites me most about dentistry and in terms of the growth and future of technology and what's to come, because it's going to be super cool, actually. Yeah.
Great. So moving on to kind of like the school side, what methods and tools did you use to study for the DAT? How did you study?
I was very blessed. I got into this program in Michigan called Profile for Success. It's a 6-week program. You have to apply. I think they still have it, and well, maybe not during COVID, but basically we went there for 6 weeks, and they paid for us to take the Kaplan course. Traditionally, I wouldn't put myself in a category as a good test taker. I'm the person that has studied a lot just to do okay, I would say, when it comes to standardized tests. And so the Kaplan course was awesome because I only had to take the exam once, and I did well. And I got interviews to all my programs. To all those schools I applied to, which was also surprising. I'm like, oh my gosh, I didn't even know I would have all these options. So that was super helpful. I did the program. That's the only thing I used to study. And I think after finishing it up, I studied for like 2 more weeks and before I was scheduled to take the exam. My biggest advice for that is just to get it done as soon as possible and to not stretch out the study time. I think when you stretch it out, you just get burned out and you start forgetting stuff. And I think the faster, you can, like, the more diligent and hard you can go at it and knock it out, the better. Instead of pushing it back. That's just not. I don't think you'll have a better outcome the other way around. Just get it done. But I definitely think that if some type of aid, if you can afford it. I know these programs are expensive, but for me, it was super helpful, like super helpful.
Thank you. That's great advice. So, last question here, since we're nearing our hour. Is there anything that you wish you did differently in dental school?
I was the type of person, I did everything. So I took advantage of a lot of opportunities. I think, but you didn't ask that. You said that I did it, and I hate, because there has to be something, right? That I would have done differently, you said?
Yeah.
Okay, I'll say it. So, actually, I told you guys that in the beginning of me starting dental school, I wasn't committed to the specialty just yet. I was, taking the approach of learning about each one and then crossing them off. And although I knew I wanted to go into my fourth year, instead of going into general dentistry, I said I just wanted to do a GPR to get some additional surgical training before coming back to press. And the only regret I have, because I basically ended up changing my mind at the very last minute, which means I didn't get the really full experience of applying to other specialty programs and such. So I would just say go with your gut. You know, if you're feeling like you're really attracted to something, don't try to talk yourself out of it or try to make sense of reasons for you to go one way or the other, because you really know. You really know at that point in time, at least by the end, you know, what you like. And also, if you don't know, it's okay. You know, I think also sometimes people, they think they know, but they didn't really get their whole foot in the water, just the toes. It's like, it's okay to take some time. So, you know, go with your gut, but also don't feel pressed. I don't really know, but yeah, I regret not, you know, waiting to the last minute to make a decision to say, oh, let me just do it now instead of waiting a year, if I had to pick anything. But take advantage of all the opportunities you have in dental school, because there are a lot, a whole lot, or any program. But yeah, take advantage, I'd say.
Well, once again, Dr. Jackson, we'd like to thank you for your time and for the time you took to answer all of our questions and for this wonderful presentation. And we're definitely looking to have you again with more cases and details on all the cases you've done before to have more insight.
And I'd love to connect with somebody else who wants to. Please, if you can see my email me. I would love that.
Yes.
If you have questions, more specific questions about, you know, your own self as an applicant, if you want to do a mock interview, advice, anything, I'd be happy to do that.
Well, thank you so much. And to all our viewers, we will post the quiz within a few minutes after ending the sessions in our GroupMe chat. So have an eye on that. And thank you all for attending tonight's session. We'll see you in next week's sessions. Thank you all, and I hope you have a great night.
Night.
Thank you.